The medication that I'll be administering today is cefazolin. The class is an anti-infective. It is used to treat severe infections of the respiratory tract, skin, and soft tissue. Some side effects include fever, skin rash, and anaphylaxis if hypersensitivity occurs, as well as nausea, vomiting, diarrhea, cramps, or pain at the IV site. The onset is rapid, the peak is 5 minutes, and the duration is 6 to 12 hours. Some nursing implications include to observe the patient for signs and symptoms of anaphylaxis, and to discontinue and notify the healthcare provider immediately if this occurs. Keep epinephrine close by in case of emergency. Monitor for bowel function and skin rash during therapy, and this medication is contraindicated in renal impairment. So, two policies include the compatibility of IV meds with other medications and fluids running through the line must be assessed and confirmed prior to commencing administration. It is important to confirm patient identity as per the positive patient identification policy and procedures. At this point, I would have already reviewed the drug monograph, and now I'm going to open the chart and review the patient's information. So the patient I'll be working with today is Sid Garland. He's a 54-year-old male that has been admitted to the hospital for a below-the-knee amputation of his left leg. The patient has suffered from a gangrenous foot ulcer for the past year prior to his amputation. The patient is awake for surgical rounds. His vitals are as follows: 38.5 degrees Celsius for his temperature, his heart rate was 110, his respiratory rate was 18, his blood pressure was 120/75, and his oxygen levels were 98% on room air. The surgical team removed the left leg dressing to assess the surgical site. The bandages were changed with a large amount of serous sanguinis and purulent drainage. The wound was redressed post-assessment, and the patient rates his pain as a 7 out of 10. Subcut analgesics were given as ordered, and repeat CBC and wound cultures were sent to the lab. So the patient's blood work shows that his white blood cells are flagged as high, as well as the neutrophils, monocytes, and basophils are all flagged as high as well, which is consistent with the patient fighting an infection. His wound culture also shows that the bacteria Staphylococcus was present in his wound. Now I'm going to sign the signature chart. Now I'm going to compare the doctor's order to the MAR. So the patient's name is Sid Garland. The patient's name is Sid Garland. The medical record number is 344316. The medical record number is 344316. Sorry, I'm going to start over. The patient's name is Sid Garland. The patient's name is Sid Garland. The medical record number is 344316. 344316. His date of birth is November 8th, 1965. November 8th, 1965. His allergies are penicillin and codeine. His allergies are penicillin and codeine. So the medication is cefazolin. The medication is cefazolin. The dose is 500 milligrams. The dose is 500 milligrams. The route is IV. The route is IV. The frequency is every 8 hours. The frequency is every 8 hours. The directions are, this is to be given for 7 days. The directions are that this is ordered for 7 days. And I will be administering the 6 a.m. dose. And this medication is ordered to treat the wound infection that this patient is experiencing. So now I'm going to just note that the normal saline, the IV line, the main IV line, is running normal saline at 125 milliliters per hour. So I'm just going to note on my worksheet. And then I'm going to review the drug monograph. So this medication I will be giving in an IV mini bag. So for an IV mini bag for cefazolin, it is to be diluted in 50 to 100 milliliters of IV solution and to be infused over 10 to 60 minutes. So I will be administering it over 15 minutes after calling the pharmacy and confirming with them that they want it to be administered over 15 minutes. So for compatibility, cefazolin is compatible at the Y site with enalapril, which the patient also has an order for enalapril. And the cefazolin is also stable, compatible with the diluent normal saline, which we will be using, and it is also compatible with the main, what is running on the main IV line, which is also normal saline. It is compatible with that as well. So now we are going to go in the patient's room and just assess for the IV and just check everything. So I'm coming in the room. Good morning, St. Garland. How are you today? Okay, so I'm just going to check the IV bag and make sure it's the right solution. So it is running normal saline, and the expiry date is December 2020. And I'm just going to check that it's running at the right rate. So it is running at 125 milliliters per hour, it's labeled. And I'm going to just check that the line doesn't have any kinks all the way down the line, up until the hands. And then I'm going to assess for any phlebitis, any signs of infiltration at the IV site. And I would also take the opportunity to assess the patient at this point. I would assess for his vitals. I would assess for any signs of infection. And I would also just take this time to go through any allergy history with the patient, check if they have any previous allergies or if they had any history of reaction to the medications. Now I'm going to go back to prepare the medication. And now I would perform hand hygiene. And then I'm going to grab the correct medication from the patient's drawer. So the medication has 2 expiry dates, so I'm going to check the medication expiry date on the label, which is August 2028. And I'm going to check the expiry date for the solution, which is November 2020. And now I am going to perform my first check with the IV bag to the MAR. So the patient's name is St. Garland. The patient's name is St. Garland. The medication is cefazolin. The medication is cefazolin. The dose is 500 milligrams in 50 milliliters of normal saline. The dose is 500 milligrams. The route is IV. The route is IV. And the site will be the patient's left hand, which we saw in the room. The frequency is every 8 hours. The frequency is every 8 hours. The special directions are that this is ordered for 7 days. And we will be administering the 6 o'clock dose. And the reason for administering this medication is to treat the infection at the wound site. And now I'm immediately going to perform my second check with the IV bag to the MAR. So the patient's name is St. Garland. The patient's name is St. Garland. The medication is cefazolin. The medication is cefazolin. The dose is 500 milligrams in 50 milliliters of normal saline. The dose is 500 milligrams. The route is IV. The route is IV. The site will be the patient's left hand. The frequency is every 8 hours. The frequency is every 8 hours. The directions include that this medication is ordered for 7 days. I will be administering the 6 o'clock dose, and the medication is ordered to treat the infection at the wound site for the patient. Now I'm going to perform my calculation for pump and gravity for the IV rates. So So I performed my calculation for pump. I got that it would run at 200 milliliters per hour, and for gravity I got that it would run at 33 drops per minute. So now I am going to perform my third check with the IV bag to the MAR. So the patient's name is Sid Garland. The patient's name is Sid Garland. The medication is cefazolin. The medication is cefazolin. The dose is 500 milligrams in 50 milliliters of normal saline. The dose is 500 milligrams, and the rates are for pump 200 milliliters per hour, and for gravity it's 33 drops per minute. The route is IV. The route is IV. The site would be the patient's left hand, and the frequency is every 8 hours. And the frequency is every 8 hours. The special directions include that this medication is ordered for 7 days, and I will be giving the 6 o'clock dose. The reason for giving this medication is to treat infection for the patient's wound site. So now I would turn my calculations over and double check my calculations for pump and gravity again. So at this point, I would take my calculation, I would take my mini bag, and I would take the MAR, and I would have my instructor come over to double check my calculations and my mini bag before heading into the patient's room to administer this dose.